Hello and welcome to Movers and Shakers. I'm Ken Miller. Today I'm joined by 40th District State Representative David French. We're at the end of the Kansas legislative session for 2021. David, thank you very much for coming in today.
Thank you, Ken.
All right, so the legislative session for 2021 is in the books. And as we always do at the end of the session, we start with the budget. So what did you like, not like about the priorities that were outlined for the upcoming budget years?
Ken, you well know that last year the legislature had to adjourn early, 2 months early. So we basically just kicked out a budget last year as quick as we could to get out of town. So didn't do much else. I think we did 13 bills total last year. So the budget last year was pretty slim, trying to just get it done. This year has been I think it's been a very good year. We've had a lot of good things done, some bad things, some ugly things, the good, bad, and the ugly. It happens every year. But it's been a good year, I think, for the legislature. It's been a good year for Kansas and Kansans. So I'll be glad to talk more about the budget. There was actually 3 budgets this year that we voted on. There was 5 votes on those budgets. So I voted on all 5 of them. There's a general budget that we have to pass according to the Constitution, and it passed the House with a good-sized majority back in the early part of the session. It then went to the Senate. The Senate did their thing. We did a conference committee on it. It came out as HB 2007 was the general budget that we passed out. I voted yes on both the House budget and the final budget. The other budget was the school budget. This year they separated out the school budget from the primary budget. So it's a separate budget altogether. The school budget's 60% of our total budget, so they just figured it needed to be a separate bill so we could discuss it separately. That bill was in the House. I voted for it, went to the Senate. The Senate did their thing, went to a conference committee, came out. It basically had all the funding that was recommended by the governor, but they had stripped out a bunch of the things that I thought we needed to have: more accountability, more options for parents, trying to figure out where the money's going and why we're not getting better schools test scores. So when that final budget came around, I basically just giving more money with no accountability for improving the grades. I voted no on the actual school budget, but it was passed, and so it's a done deal. And the final bill was the omnibus bill. The governor provides a budget to the legislature every year, early in the year. The legislature then reviews it, approves it, cuts it, adds to it, all of that, and then it goes back to the governor for final approval. But during the time frame when she submits the budget and the budget actually gets approved, the agencies come in with a whole bunch of other, last minute
wish lists.
Yeah, last minute things that they just have to have for the year. So that's the omnibus bill. It basically goes and covers anything that wasn't in the original budget. So let's talk about the budget. The governor's recommendation for the budget this year was $21,271,977,467. A little over $21 billion. With a total state employee, full-time employee list of 40,837 people. That's the payroll for the state. The final budget for 2021, which is going to end this month,
June 30th. Yeah.
was a little over $120 million more. It was added on to the governor's recommendation. So that's how much was added on. For 2022, the governor had actually reduced her recommended budget by about $300 million. But again, we've taken the education budget out. So the actual budget that was approved by the legislature and approved by the governor was $15,425,000,000, which basically is the difference. We're going to talk a school budget and how much we're giving to the schools. So it's 15 million versus the original 20 billion dollars. The ending balance, which we kind of track every year, what's in the bank at the end of all the expenditures. 2021, we ended up with $648.5 million. The estimate right now is for FY 2022, we're going to have $10.2 million.
Close to a zero sum.
Pretty much, we're going to spend everything we're going to get if everything goes according to the estimate. Let me just tell you a few things that came out of the budget real quick, Ken. Some important items, the top level things that I think are important. There were numerous expenditures for addition for health care, mental health, but a lot of those are just, they're not big items. They're just $1 million here, 500,000 here, whatever. So I'm not going to go into those. We'd be here another 30 minutes if I did all of those. So this is just the big things. The governor, again, for the third year in a row, recommended that we amortize the Capers loan, basically just renew that loan, to get about $167 million this year by doing that, but then over the 25 years of the extension, the taxpayers would be paying about $4.5 billion in extra interest. So again, the legislature did not recommend that, took it out of the budget. Again, the Department of Education budget was decided to be pulled this year and put into a separate bill because of the reason it's such a big part of the budget. The state salary increases, those are normally put off till the omnibus bill anyway, so we make sure we have enough money to actually cover those raises. It authorized the Legislative Budget Committee to oversee all COVID relief funds and to make recommendations to the Legislative Coordinating Council, which is the organization that basically represents the legislature when we're out of session, to make final approval on all COVID expenditures. I don't know if you know, but last year the governor set up what she called the Sparks Committee.
Right.
And it basically oversaw all the federal money coming in. Hundreds of millions, up to billions of dollars of federal money coming in, which allowed her to basically choose winners and losers where that money went. And we just think the legislature needs to be involved in that. That's our responsibility, is the funding of our government. So that has been added in. We set up a youth suicide prevention mobile phone application. You know as well as I do, over the last year we've had an increase in youth suicides based upon this COVID and all the restrictions that's been put on them. So we've actually going to have a mobile phone that they can call up and get help before they make that final decision. We decreased the concealed carry permit from $132.50 to $112, which is a good thing. We want more people to be able to take that course, get the training. If you're going to carry a weapon, you need to know how to use it. So that's a good thing. Provided an additional daily reimbursement rate for nursing facilities. You know, nursing facilities were just overwhelmed this year with last year with COVID, and so the state is going to provide additional funding to them for the extra effort they took with all the extra precautions they had to take. Provides a 3% of the lost revenues for the Board of Regents, our state universities. You know, most of them had to send all their students home last year, so there was a big reduction in their income, so the state provided a 3% of that loss back to them to help cover that. It provides additional funds for the Career Technical Education Tuition Fund. This is something that provide an option for students, instead if they don't want to go to college or can't go to college, provides them another option to
Right.
go into the technical field and maybe make more money than they could as a college graduate. It provides additional funds for the National Guard Scholarship. Again, National Guard recruiting is critical, that we keep our National Guard fully manned. And that scholarship, providing them a chance to get an additional education, is very important for their retaining the number of personnel they need. Provides additional funds for the Juvenile Crime Community Prevention Account. Don't know if you've heard of that, but it's an additional funds that are going to set up for communities that do programs for prevent juvenile crime to get extra money. So I suggest that Lansing looks into that. If they have any kind of a program that, especially our recreation and parks, should look into that. If they're doing something special to help prevent juvenile crime, then there should be some money there for the city.
Okay.
It requires the Adjutant General, who is in charge of the COVID response, to report all COVID expenditures for 2020 and 2021. We really don't have any idea how much money we have spent on this COVID thing, and so the legislature wants some kind of accountability of how much it's cost us to respond to this. Real quick on the education budget. That was HB 2134. We allocated $5.8 billion in 2022 for K-12 funding. That is about a $150 million increase in their budget this year, next year. But they've also received over $1 billion in COVID federal funds.
Right.
So the schools should not be hurting for money, even though they've had to do a lot of extra precautions because of COVID. They were closed down for a lot of the year, and they've cut back classes for part of the year, so there should be plenty of money there for education.
Okay.
The omnibus bill that we did, it was done on the last day of the working session. We added $14.4 million added to the budget for next year. There was no increase in the state employee pay though. Again, we didn't have an omnibus bill last year, so this is 2 years in a row the state employees are not getting any kind of pay raise. And I guarantee you the health benefits have gone up more than that.
Right.
And this is one reason why I voted against the omnibus bill, for that one reason. To me, I just don't think we can allow our state employees to keep losing money for doing their job.
Right.
So that was the big one for me. We also gave a small increase to state employee pay. Not for state employee, for judges. I don't know if you know, Ken, but our judges are ranked 48th in the nation for pay on the pay scale, and it's hard to get new judges in our system because of that. It doesn't pay a lawyer to give up a $300,000 business to be a judge for $125,000. Just doesn't make sense. So it's getting harder and harder to keep judges, to get new judges, and so we gave them a 5% increase this year. The recommendation from the committee that I'm on was to give them 5% this year, 5% next year, and 5% the following year. 3 straight years, 5%. That's 15%. Try to get them up a little bit anyway. They wanted 21%, and we just said the budget just couldn't handle it. But they do need something, and I was glad to see they did get the 5% this year and next year, but nothing guaranteed after that. The big problem I see in the judicial system is that the judicial staff is really underpaid, and they have a hard time keeping the people they have, and getting new ones. And that is a profession that you just don't go off the street and get new people. It takes a lot of training and years of experience to do this kind of job. So we gave them a medium increase. I think it's like 12 point some million dollars, with no more than a 12% increase in pay for them. The big one that we really did to help the judicial system was we allowed 70 more new caseworkers. They asked for 70, and we gave them 70 more caseworkers, basically parole officers, to help with taking care of that side of our corrections system. And I think that's about it. I want to say that, like I said, we could talk a lot more about the other expenditures that we did on the budget, but I think those are the big ones.
Okay. And that's a lot of information. Let me ask you though, and you mentioned state employees and you mentioned judicial, and how even with what you did for the judicial folks, they're still pretty much woefully undercompensated,
Yes.
right? Are you concerned, and you mentioned this in one of your responses, are you concerned about a brain drain, not only with the judicial branch, but just state employees in general?
Absolutely. I mean, you get what you pay for,
Right.
Ken. And if you keep basically saying, you know, great job, people, but we're not giving you any extra money, there's really no incentive for them to not be out looking for another job.
Right.
I mean, it's what you and I do. If we
Right.
don't get any more money than what we're getting, we're going to be looking somewhere else unless you're really happy with your job.
Right.
Now, I'm not saying that we don't have maybe too many state employees. 40,000 plus state employees.
Right.
Do we need them all? I don't know. I mean, that's a lot of people. But I do know if you want good people, you got to pay them.
Right.
And I don't think we're doing an adequate job there. We're cutting corners. We're adding on to other places and not providing we're shortchanging a lot of
Right.
important parts of our government.
Well, and another hidden part of that is, you mentioned capers, and
Yeah.
the legislature was successful in kind of fending off, kicking the can down the road again, which seems to be suggested every session.
Right.
I think prospective employees or state employees that might be thinking about leaving, that's another part of the equation. If you're gonna start threatening my capers again, I may just decide not to be a member of the state workforce.
Absolutely. And capers is a big one.
Yeah.
Retirement pensions are a major factor in
Right.
where you want to work.
Right.
You got to look down the road.
Right.
And right now, it's the other issue with capers is there is no cost of living allowance factored in with that, so they don't get any kind of automatic increase in pay. Whatever they agreed to when they retired is what they get forever.
Exactly.
Another issue that I think we're going to have to look at. Some people say it's okay. I think there needs to be some changes to that. We all can't just live on whatever we're making. We got to have some increase. Our standard of livings will continue to go down. So, yeah, that's another issue that we need to talk about.
Okay. All right, so we're recording this interview on June 9th, and it'll probably play for about a month on Channel 2. We'll have it on the website slightly longer. So I did want to date it so that, because information changes over time.
Sure.
As a matter of fact, on June 15th, so 6 days from now, the state of emergency related to the pandemic is scheduled to end. Some other provisions ended earlier than that, and in that case, I'm referring specifically to the block on evictions. That has expired.
Yes, it has.
Talk a little bit, and you alluded to this in the budget. How could you not? Because it's very money related. But talk about the state's pandemic response now that we're almost to the end of the tunnel.
Well, we hope.
We hope.
That's
right. Good point. Who knows?
I'm not sure we're full circle yet
Right.
on this thing. It's been a very bumpy ride this year, as we all know. A lot of good things have come out of this, so I'm not going to focus on it first. The response from our EMS and our National Guard personnel has been outstanding. I don't know if we could have got through it without their immediate response and their continuing response. So they've been invaluable to this whole effort. And you have to give a shout out to the people of Kansas. For the most part, they have responded to the emergency and trying to follow the guidance that's been put out and to help try to keep it under control. So those are the good things. The problem that I have seen is that the government guidance for this thing has not always been very clear, and at times it's been draconian in the response. The governor made her emergency declaration on March 12th of last year. Based upon all the information that was coming in from the federal level, I think that was a good decision. We had no idea what this was and where it was going.
Right.
So we needed that emergency declaration to get things moving, get the National Guard out, start helping people, preventing this from getting any worse than it was projected to be. So it was the right thing to do. The fact that the emergency has continued now for well over a year has been disturbing to me. I don't think it's really been an emergency for quite some time. It's still an issue that we need to be aware of, but it hasn't been an emergency for quite some time. The governor gets to declare an emergency for 15 days for anything she wants. When she sees there's a problem, she can declare an emergency for it and get things rolling, which is good. That's what we want. We want to get everything out of the way, just get people on the ground, get things solved. But after 15 days, there's still a problem. She has to come back and get an extension. That extension is granted by the legislature if we're in session. If we're not in session, it was done by the State Finance Council, which is run by the governor and controlled by the governor, and she has pretty much control of it. So she kept asking for more extensions, and the SFC kept giving them to her. They kept coming up with excuses that, the federal funds will go away if we do away with the emergency. We got behind on the judicial cases, and so if we end it right now, we're going to have no more speedy trials because it's going to take months to get the backlog done.
Right.
So it's just got so the extensions just almost became automatic. Every 30 days another extension. Last summer the legislature had a special session, got together and put some restraints on the governor's actions. We thought that those needed to be done, and to do that we gave her an extended, I think it was like 3 or 4 months extension on this emergency so she could go ahead and get it over with. Unfortunately in September it got extended again and extended again, and we just extended it again the end of March to May. We extended it, the legislature did, and then as soon as we adjourned, the Legislative Coordinating Council gave her another 15-day extension till, like you said, June 15th. I think they have made it very clear that she needs to make sure that it is concluded by then. She should be making preparations for it to end, whatever that is. Don't know. They are meeting next week on the 15th to consider another extension.
Right. If you're a gambling man, what's your...
Well, I know the people that I know on the council say this is it. So I believe it's the end.
Okay.
But I've been saying that for quite some time, and it keeps getting kicked down the road. So
okay.
I guess right now I would say hopefully it's ended. The emergency has ended a long time ago. Like I said, I think we are still having to track this. We need to continue to be concerned about it, but it's not an emergency anymore. So it needs to end.
Okay. All right, well, the Kansas Department of Labor has been in the news for all the wrong reasons for a long time now.
Yep.
I mean, you can't watch TV, from Kansas City or Wichita or Topeka without seeing a story about somebody who's been trying for 6 months, 9 months to get the benefits that are due them, and they're getting the runaround, whether that's technologically speaking or otherwise.
Right.
All right, so do you think we're any closer to solving the technology and the other problems that have hurt Kansans who really need that department's services. Now, to be fair, and again, we're recording this on June 9th, within the last day or so, a story has come out where there has been progress made, not completely clearing the backlog, but making progress towards it. You've been on top of this. What are you seeing, and is it getting better?
Like you said, there's been all kinds of stories about this. You'll see my email list. I mean, I get emails probably at least 10 to 20 a day.
Constituent emails?
Well, a lot of them are constituents. A lot of them are just people out in Podunk, Kansas somewhere wanting anybody to help them.
Right.
Because they can't get their benefits. This has been a total disaster for so many people. And like you say, it's only fair to mention the fact that the system wasn't prepared for the number of unemployment claims that came in right off the bat. We lost so many people lost their jobs right off the bat when started saying you're not essential. Well, then we don't need you. You're gone.
Right.
So that was the big thing that broke the camel's back. Basically, the system we had was not capable of handling all those claims, and the longer it went, the worse it got. And then the issue was the governor tried to catch up, kind of let some of the safeguards go by the wayside, and we had a big fraud campaign that was initiated against the state unemployment. A lot of claims came in. A lot of it went overseas. There's been estimates anywhere from $300 to $600 million we lost out of the unemployment fund. Most of it went overseas, and we'll never see again. So that's a big loss for the state right there. That doesn't help the people out there that actually have legitimate claims and have tried to been getting their money. Some of them got some money, and then it got cut off because of the fraud stuff. They quit paying them. The Department of Labor got a whole new software system in January to try to reduce this fraud issue. And unfortunately, when they did that, the side effect was a lot of the people that had legitimate claims
got dropped,
got kicked off the system. And they've had a hard time getting back on. So it's been a mess, Ken, and it's going to be a mess for a while. The legislature did pass a considerable amount of money to go into the Department of Labor to try to fix this for the next pandemic, because we know there's probably another one coming down the road, and we're going to probably have more people losing jobs. And so we got to be prepared for that. So we have allocated money. Hopefully it will go to the right places and get it fixed. But right now, for those still that are on trying to get the system fixed, like you said, it's maybe they're getting to the point now they're going to get it fixed, but it's been a mess, and there's been a lot of lives significantly affected by this whole thing, and it's a shame.
Right. Okay, when we visited last, I think it was right at the beginning, it was in January, it was right around the beginning of this legislative session, and I asked you about a series of anticipated issues and themes that were going to come up. And I've listed a couple of them here, and I have given you this information of what we were going to talk about, because I wanted you to be able to be prepared. So, and none of these are going to be a surprise because they've been written about, they've been talked about. But let's start first with Medicaid expansion. That's been an issue for years now, whether Kansas was going to join in what a lot of other states have done. What's the latest on Medicaid expansion here in Kansas?
All the issues that you're bringing up are, I would say, important to a lot of people in Kansas. There are people passionate on both sides of these issues. And as a conservative, I'm probably more against them than I am for them. Especially some of them I'm very against. Some of them I'm still trying to figure out if I can support them or not. But Medicaid expansion, of course, has been the #1 priority of the governor since she became governor back in 2019. She sells it as being the health care needed for 160,000 Kansans who do not have health care. And you have to have compassion for people that do not have health care right now, because it is expensive, and you can be denied health care if you don't have some kind of insurance.
Right.
I have compassion for those people, but I also have compassion for the people that are already on Medicaid that are going to be suffering because we're putting more people on that really could be on commercial plans. Medicaid expansion is really nothing more than adding more people on government health insurance. And I think down the road that is the wrong way to go. Eventually you're going to lose doctors, because doctors are not going to just work for the state. They're not going to want to work for the salaries. The state's going to pay them. So you're going to lose doctors. You're going to lose people going into the doctor profession, medical profession in general. There just won't be the money there is now. If the government's in charge, they're going to restrict the amount of money that's paid for each incident. So to me, that's the biggest problem, is that this is leading us down the wrong path. I know that the federal government came out this year offering additional funds to the state to accept Medicaid expansion. They're doing everything they can to entice the state to take it on, and then I can see them, down the road dropping it, and then we're stuck on the hook for paying for it all. And it would break the bank if we had to pay for the whole thing ourselves. So I'm very apprehensive about Medicaid expansion. It was voted on by the House in 2019, passed the House, went to the Senate. The Senate didn't take it up. So it died in that term, the 2019-2020 time frame. This year, it came up once during this session. It was defeated in the House. And so it's still out there. She still wants it. The Republicans in the House and the Senate continue to fight it. So I don't think there's any middle ground there. I don't see it happening in the next year. But she continues to make that her cornerstone of her platform. So it's going to be a continuing battle.
Right.
It's not going to be ended, I don't think, in the next year.
Okay. All right. We talked a little bit about medical marijuana, which has been brought up, I would say, for decades. It always seems that a bill surfaces, if not every session, almost every session. Now, as you well know, we're almost surrounded by states that are allowing it. It's been progressing across the country. Where does it stand in Kansas?
Well, for the first time since I've been in the legislature, it came up this year in the House. It was, in fact, one of the last things we did. I think it was on the last day of the working session that it came up. And I was surprised it came up, but it came up, and it passed.
The House?
It passed the House. I voted against it. But it did pass the House. It went to the Senate. The Senate didn't pick it up. Again, it was the last day, so they really didn't have much time to pick it up anyway. They could have if they wanted, but they didn't. So it's on their agenda for next year. I don't know where it's going to go, but my feeling on medical marijuana, of course, is that it's nothing but a stepping stone to recreational marijuana, which I am totally against. Medical marijuana, I'm still not convinced is the right choice. You get a lot of anecdotal information about how it's so successful for some people, but I don't see any real studies that show it's more effective than any other legalized drug we have for the same type of symptoms or diseases. So the only reason I'm really against medical marijuana is the fact that I just think we're just opening it up for the big money that's in marijuana to come into this state. They want in so bad. Like you said, we're surrounded already. The logical thing is we might as well have it here too. But all you got to do is go to Colorado and see what's happened to Colorado with their marijuana bills. And we've got people from Colorado coming in here every day trying to get away from it. So to me, it's an issue that's gonna be ongoing. I think it's probably gonna come, like you said, we're surrounded, so I don't think we can keep it out, tell you the truth of the matter. But I'm sad that we can't.
As a point, just so I understand, so the House passed it, the Senate didn't take it up because it happened late in the session. But next session, you really have to start from scratch. No? So the Senate would be able to pick that up?
Absolutely, first
without
day.
having the House do anything additional?
First day, they can pick it up
okay.
and vote on it and make it happen.
Okay. Kind of sort of related in terms of we're almost surrounded by it, maybe not to the point that we have states with medical marijuana being legalized. Something we talk about, something that I'm kind of interested in, sports gambling. You're seeing it on the East Coast mostly. I know Iowa has legalized sports gambling. I know there was a lot of talk during the beginning of the session, and we kind of discussed this when we got together, about obviously Kansas casinos are very interested in getting a piece of that. You've got the people who want to see it on phones, that you could gamble through an app. But that was an issue, in my opinion, that seemed to kind of peter out. You didn't hear that much about it. And I heard there was a lot of disagreement within the gambling industry itself about how you would regulate that and how you would present that to the public to use. So what's the update on that to your
Yeah, I know you've been asking about that for several years now. It really hasn't come up on the radar screen since I've been there. But this year it did. It actually got on the floor of the House for what we call a vote of the Committee of the Whole, where you basically debate the issue before you actually vote on it. And it lost in that committee, but it had a lot of support too. So I think we're probably headed that direction. I see a lot of problems with sports gambling. I think of Johnny Bench. You know,
right. Pete Rose, yeah.
Pete Rose.
Right.
Pete Rose. It's a very lucrative way of making money on sports, and it may taint the sport that it's associated with. So I'm really concerned about that. You always hear the old story about the guy that lost his rent money going to the track. Again, we have the problem with gamblers that they don't know when to quit.
Right.
And I'm also very concerned about the wagering on animal racing.
Horse racing, dog racing.
Dog racing. I've heard some horror stories about how those animals are treated. I've heard some good things. People say no, they're treated better than most dogs. I don't know. All I know is that if there's profit involved, there could be shortcuts in taking care of those animals. I don't know, but I think there are some issues there. If we go and have sports gambling, I want it heavily regulated and oversight of what's going on.
Kind of like the Kansas lottery in that term, or as far as the oversight goes?
Oversight, I think that's where it would go, is to the Kansas lottery for oversight, yeah. But as far as regulations, I'm not sure who would regulate it, but it would have to be regulated.
So taking your comments at face value, and obviously you don't have all the details because another bill would have to be put together and you have to see that, but you are skewing towards not wanting to see sports gambling in Kansas.
I'm concerned about it, but I am probably on that side of the against it right now, but I'm not totally against it.
Okay, all right. I wanted to wrap up, and this is, it's not the most exciting issue, but it's an incredibly important issue.
Very important.
And that, of course, is because of the census being completed, and that in and of itself is probably a minor miracle. Let's hope it was completed accurately.
Amen.
But you've got legislative and congressional redistricting coming up. Let's start with, as you understand it, the time frame. When, and this gets all the way down to the wards in Lansing, not to mention congressional districts, and the balance of power really is what we're talking about here. So as you understand it, when will the census numbers be presented to the point where states and even localities can start working on redistricting?
Well, you're right. The census was supposed to be done last year, and because of COVID, it was delayed. Again, I agree with you totally. I hope it was done right and completely. I have my doubts. I don't see how they did it, to tell you the truth of the matter. But if we have it right, the numbers already come in. We've already been confirmed that we're going to have 4 congressional
Right.
districts
Right.
again.
Again, we didn't lose.
We didn't lose any,
Right.
like some states. We didn't gain any, like some other states.
Mhm.
But we're keeping our 4 congressional seats. So we already know that
Mhm.
based upon that kind of population. We get down to determining borders
Right.
of districts within the states.
Right.
That information really isn't going to come in. I've been told until like September,
Of
October,
this year.
Yeah.
Okay. Okay.
which is late. I mean, normally you'd get that information early in this year. You'd have time to start working on it,
Mhm.
but it's going to be September or October before we get the information we actually need to do those redistricting
Mhm.
within the state. We already have a committee that's working on it, doing what they can with what the information they already
Mhm.
have. But it's going to be coming in late, and I've been told by members on that committee that if they get it by the fall, they will have the new boundaries ready before the next election campaign next year.
So in 2022.
It has to be done.
Right. It
Yeah.
has to.
It has to be done by 2022. We need to get early enough that campaigns can, you don't want somebody running in a district and the
Right.
district
District
changes.
changes. Right. Right.
So, yeah, they think it's okay right now, as long as we get the data. You're absolutely right, it is a big political football. Each side wants to maneuver those
Sure,
lines,
sure.
the old gerrymandering.
Yep.
You just keep these people on this
Mhm.
district, and they won't influence my district.
Right.
It's very political.
Well, and as you well know, it could be just the shift of one neighborhood that could determine the winner of 2 races.
Absolutely.
Yeah.
That's the way it works.
Yeah.
That's the way, if you look at some of these district maps, you'll see that there's just some weird lines.
Mhm.
And they're supposed to be trying to keep, a equal number of voters
Right.
in each of the districts, so that it should be just like, almost like a square. There's a
Mhm.
square here, a square there. But it's not. You have this going over here and this
Right.
going there, and it's all political.
Yeah.
And
Absolutely.
it's a system we have. Nobody's gonna probably be happy with it. The legislature is tasked to do the redistricting. And so, like I said, the committee's already started working on it. They will come up with a plan. They present it to the governor. The governor will look at it. She'll probably say, I don't like it. So there'll be trying to do some compromising,
Mhm.
trying to come up with a compromise. And if they can't do that, then it goes to the judicial
Right.
system,
Which it did last time.
which it did last time, and the judges then decide, which is very dangerous,
Mhm.
even more dangerous. So I hope that we and the governor can come up with a good plan. But you can expect the district still to look kind of weird.
Mhm. Any other topics that we haven't covered that you saw bubble up during the legislative session that you think were very important and maybe flew under the radar that people weren't aware of?
What was one that I wish I'd have thought of that before.
Yeah, I should have prepped you for that one too.
There were a lot of things that just kind of popped up out of nowhere that I was surprised to see this year. Nothing that I can remember that actually got passed. So I think that's about all I can tell you right now. I'll be
Were you
glad-
surprised at the session? And maybe I shouldn't be surprised, but I usually am surprised when the session isn't extended, when you go into overtime, and you didn't this year.
You normally don't have to do that in the odd number of years, because this session just is going to flow into the next session
Right.
next year. So
Right.
nothing is complete.
You have no House or Senate races this November.
Well, but the business is just going to continue.
Okay.
Like we talked about the medical
Right.
marijuana.
It's a 2-year. Right.
It's a 2-year
Right,
thing, so
right.
it's still on the docket for next year.
Mhm.
For the Senate. It's not going to go away until the end of the year. Now, if
Okay.
it's not worked by the end of the year, everything's gone.
Mhm.
And we start all over
Right.
in 2022,
Right.
or 2023.
23. Right.
Yeah.
Right.
So, I don't know, I think we're just Don't know.
Well, we'll leave it at that,
I think so.
and you'll be back. So I want to thank 40th District State Representative David French for stopping by today. For Movers and Shakers, I'm Ken Miller.